A very good evening to you all. Welcome to session 12 of Life and Homeopathy Through My Eyes. And today's topic is Your Hair, Your Crowning Glory. A young girl once said, whether my hair is normal, whether life is normal or not, but hair should be. And it struck me how important hair is, or how difficult dealing with hair loss. Well, agree, hair is that crown which adds to our confidence, our self-esteem. It is that part which adds to our identity. So, love is in the hair, not in the air. Well, viewers, before we lose sleep trying to think about the hair loss, the hair problems, or rather, in other words, I would like to say, before you lose more hair thinking about your hair concerns, I would like to say we have on our session today an experienced hair transplant and plastic surgeon, Dr. Kiran Naik. He has been consulting at Nanavati Super Speciality Hospital and has 2 private clinic setups at prime locations, Bandra and Borivali. With an experience of not 1, not 2, but almost 3 decades, he shall help us resolve and answer and has answer to the questions that we would have for him today. So looking forward to having you on our session, Dr. Kiran. Our viewers are waiting for you. Well, he has joined in just a few seconds before he would be here. Well, I think there are some logging issues. We are waiting for his presence. So before he logs in, let me tell you also that I have known Dr. Kiran for quite some years. Rather not some, many years. We passed out from junior college together. So that's been a really long time. So knowing him from those days, I would first want to ask Dr. Kiran. Dr. Kiran, we are waiting for your
Hi,
presence.
Prabha. Yeah,
Hi.
can you? Yeah, I'm online. Can you see me?
No, I can't see you, but I can hear you. You can see me?
I can see you very well, actually.
Well,
I think
there is some, the Wi-Fi issues are there, but well, I can hear you, and I think it would happen soon that we would be able to see you too. So,
yeah, I hope so
shall
too,
we
yeah.
continue? Yes.
Yeah, let's do that. Yeah.
So, yes. So, how are you, Dr. Kiran?
Oh, I'm doing very well, and I see you are doing well too. So that's great for this season.
Thank you. Thank you so much. I think it's almost a year or more that we last met, and it seems like a really long time. But abhi ke liye chalo online hi sahi.
Yeah. It's 6 months since I met anyone at all. So I think we can deduct 6 months from there.
Yes. So, well, I was telling our viewers that I have known you since our junior college days. So, taking privilege and advantage of this, I would like to first ask you a personal question. Can I?
Yeah, please go ahead.
Okay. So, last that I saw you, I wanted to ask you, but let me ask you today. How have you been able to manage and maintain a scalp, a head full of hair, just like those young days? How is it that? What is the secret behind it?
So I think if you can't see me on the video, then well, I don't know whether it's a good thing or a bad thing, but I still have hair, although I'm very smart. So in anticipation of you calling me on this session, I have been growing my hair very long for the past 3 months. I have not cut them, and I've been fortunate to have some curly hair. So I just keep all the hair up. I don't comb my hair, and then everybody can't see my thinning scalp. That's the whole secret. So
Right.
that's one lesson for everybody, and that's you can do a number of tricks with your hair, and that's what a lot of expert hairdressers do. So, to make you look better.
Okay. So, wow, not all can say the same thing or can have the same type of hair which will help them or help their scalp look full. So, you are among those lucky ones, and I'm sure even genetics has played some role in your case, right?
Yes, it has. And genetics is probably one of the most important things when it comes to having a head full of hair. And usually, what we call pattern hair loss, which is the commonest form of hair loss, and which is very distressing to a lot of people. That is primarily determined by the hereditary history that you have by your
Right.
by your genetics and by your genes. Of course, a lot of other environmental factors do come into play, but yes, genes are probably the most important thing when it comes to pattern hair loss. Yeah. So
Right.
yes, I had my uncles who had plenty of hair for a long time. My dad did not, but my uncles did. So I think I'm fortunate to get some of my uncle's genes from my mother's
Wow.
side. So that helped a lot.
Wow, that's great. So viewers, though Dr. Kiran can say that even in 50s that he's been able to manage and maintain good hair in spite of that little thinning which could be age related today. Not many of us can say the same thing because in spite of our parents, our grandparents having had good hair, even people half our age are not able to say the same thing. Today, more than the dust around in the house, it is hair that you see all around. So, what is the cause of this rampant hair loss today, Dr. Kiran? Why is it so that it has become so common that everybody are facing hair related issues, hair related problems?
So as I told you, it is the whole the primary reason for having hair or losing them is in your genes. But a lot of environmental factors like your lifestyle, the stress, whether it's pollution, what you eat, um, various other medical conditions, drugs that we take, drugs, of course, pharmaceutical medications that we take, a lot of them come into play. And well, if things are unfavorable and your genes are going to show up with hair loss, then that whole thing gets accelerated. So if we are losing more and more hair today, I think probably our lifestyles do have a lot to contribute in that. um, Maybe some genetic alterations are also taking place because that's the way we evolve. And probably we are losing more hair today, that's true. uh, we can take care of it, we can try and prevent what we can, but some things are just going to happen and that we just have to accept.
Right. I think most of the causes that you have mentioned are quite a bit under our control, as you said about lifestyle. So that would include healthy eating habits, healthy sleeping patterns,
Yes.
and even learning to deal with stress in some ways or the other.
Mm.
Also, if we maintain our lifestyle, I think it could also help us maintain a good immunity and prevent diseases, which you were saying about related to hair loss.
Yes,
And
true. Some of the
where
causes
whether
I would especially like to mention, which are, I think, part of our current day living. One thing is, of course, nutritional. We A lot of people want to lose weight, and some of us have gained weight. So when we want to lose weight, you diet, and that's when you happen to lose a lot of hair as well. Putting on weight is also not great for the hair. That also causes a problem. Another thing is stress. Stress with various situations, whether it's physical stress in the form of surgery, injuries, or if it is psychological stress, some other kind of issues. They will also cause hair loss. I also want to mention, something simple. It's called traction hair loss or traction alopecia.
Okay.
And that, if I don't know if you have noticed in a lot of our Sikh brothers, Sikh meaning Punjabi Sardar brothers, and you see they have this habit of tying. Habit meaning it's their norm, and
Culture.
that is they
Right.
they tie it in a bun very tightly. And we find a lot of patients coming to us because they start losing hair from the area where the hair has been tied up, and that
Right.
because it puts a lot of pressure on the follicles. Same thing goes for
Right.
hairstyles like tight braiding or tying tight ponytails. I even see nowadays, since the lockdown, if you have noticed, a lot of males going around with this hair clips which have pulled their hair back tightly.
Right.
I must mention that that is also not a very good thing for the follicles. Constant pressure, constant pull on the hair follicles, and this can actually become a permanent thing. The loss there can become permanent.
True.
Some medications I would like to mention, especially some medications for blood pressure, for heart disease, antidepressants, blood thinners. All of them are so
Right.
common in our life today. I am personally
Right.
on some of them, and
Okay.
well, they also lead to a loss of hair follicles. So that is another.
Right.
One more thing is polycystic ovaries. There is
Okay.
a huge jump in the incidence of issue called polycystic ovaries. I think most of your viewers must have heard about it. It's also an
Right.
hormonal issue, and that also we see. Of course, it's only in females, but we see a lot of pattern hair loss happening in females with polycystic ovaries. So I think, and there's one more thing, trichotillomania. Now, this is actually a psychiatric issue, and patients who are unfortunately living with this issue, they tend to pull their own hair out and then they actually eat them up.
Right.
It could be from the scalp, it could be from the beard, it could be from the eyebrows, and that also is one thing which we must watch out for. I mentioned these few things because they are some things which we can avoid or do something about quite easily.
True.
And of course there are other things like hormonal problems, see, lifestyle issues, diabetes, smoking is one thing which really aggravates hair loss, one of the things which will
Right.
accelerate your hair loss very, very fast, and you can do something about it. So smoking, diabetes, thyroid disorders, very common nowadays. We find a lot of people having issues with thyroid function, and that also can accelerate the problem that we see in hair loss.
Right. So, well, whatever issues from these that we can deal with could be through good lifestyle. That is what you have come to. Basically, you have tried to tell us, Dr. Kiran, and that has gone well with the viewers. Also, second thing is that they know now when and how they can take medical advice at the right time before the hair loss progresses and gets worse or is irreversible. So going further, Dr. Kiran, what are the different types or patterns of hair loss?
The commonest pattern, the commonest type, because it is what we call pattern hair loss. That's the commonest type of hair loss. And you see that all around you all the time. And most of the people, I'm sure, are aware of it and see it. It's a very classic pattern. Males and females have different patterns. In males, it will start with thinning of the hair and ultimately, balding, especially on the top of the head and in the
Right.
temple region. And in females, it is generally an overall thinning in the crown region, that is the top of the head. Although in females, the frontal hairline, that is the front, the row of hair, it does not recede. In males, that goes back also and causes balding. So, well, these are the pattern ones, and this is a gradual process, and
Right.
you will not really see a kind of a sudden demarcation or something like that. If you see a sudden demarcation, patches with very few hair, and then suddenly there is nice thick hair, then it's usually some medical issue. Frequently this is because of some immune problems where your body's own immune system will attack the hair follicles and cause them to die out slowly.
Right. They would be in patches. Yeah.
Yes, patches. And then the third one is something which is very scary initially, because many people find bunches of hair actually coming out. I mean, if sometimes they are trying to just tie their hair into some hairstyle or something like that, and a big chunk of hair just comes out just like that. It's as if it's just lying there loose, and that is what we call as telogen effluvium. Fortunately, this is always a temporary, and it's very scary. And I have had patients even giving me emergency calls for that. But believe me, it really is not much of a problem. It invariably comes back. So I think these are the three main types of visual types of hair loss that we can see.
Correct. Right. So viewers, now that you have understood the male pattern baldness, the female pattern baldness, or disease related like alopecia areata, which Dr. Kiran said about it happening in patches, that is there, and you will find sudden areas of small bald patches around where the thick hair is there otherwise, and sudden hair loss related to stress or certain reasons which tend to come back to normal, but they are very scary to begin with. So keeping all this in mind, you could accordingly take action, take medical advice. But Dr. Kiran, what are the basic do's and don'ts that you would like to advise to our viewers related to hair care?
Well, a couple of things. First thing is, of course, how to help your hair follicles. And secondly, once they grow a nice shaft of hair, how to try and maintain that shaft of hair. As far as the follicles are concerned, frankly speaking, it's avoiding smoking, trying and avoid stress related situations. A very important thing is vegetarians. In our country, a significant proportion of people are vegetarian. And vegetarian food, unfortunately, doesn't have some very crucial vitamins, fat-soluble vitamins, especially vitamin B12 is absent in vegetarian foods. They also lack certain essential minerals like zinc or selenium. Iron, of course, becomes a problem if they are not eating the right kind of vegetarian food. So vegetarians definitely need to watch out and try and eat things which would help their diet to get a more balanced kind of different type of nutrients and proteins. So definitely vegetarians, I would suggest that you eat the right kind of food, and of course you have nutritional supplements for that as well. So that rule out things like diabetes. You need to keep a watch on things like thyroid. So those are basically some of the things as far as the hair follicle is concerned. Okay. And finally, I think once you do have good hair, the way to maintain it is not to be harsh with your hair. The hair shaft is basically a dead strand of protein, and you can look after it well. So simple thing like shampooing. If it is oily, you need to shampoo practically every day. There is no harm in shampooing every day. Of course, you don't need to overdo it also. Dry hair would in fact get worsened by shampooing too much. The other important thing is, in fact, hair is most vulnerable when it is wet. So a lot of people have this habit of, when they have a bath or a shower and they come out and they'll start rubbing their hair vigorously. So that's definitely a no-no, because you are going to break a lot of hair that way. So simple things like that would go a long way, conditioning the hair properly. Conditioning helps retain the moisture in the hair shaft and makes it look lustrous and makes it look thicker also. So good conditioning, good shampooing. Hair is like any other thing, if anything very hot or very cold comes in contact with it, is going to damage that hair shaft. So flat irons, hot blow drying, permanent treatments, coloring of hair, they should be done with a little bit of caution and not too often. to maintain that hair strand. Of course, you always have the option of finishing, coloring, and doing all that, because after some time you're going to lose that particular shaft of strand of hair and you're going to come up with new hair.
Right.
So, well, judicious use of hair products, judicious styling, nothing extreme, not blow drying with very hot air every day. Just being moderate in these things will go a long way in maintaining the hair.
Wow. Yes. So taking care of these, we also can tell our viewers that we have, say, around 1 lakh to 1.5 lakh of hair follicles on our scalp, and they are going through a life cycle which is in phases. So as long as the growth and the fall is maintained, there is nothing to worry about. So 100 strands of hair are usually normal that fall on a daily basis, and it's nothing to be worried about as long as they are regained. So as Dr. Kiran already told and suggested, if these causes are taken care of, then naturally the hair fall would not go beyond 100, and it would be limited to what is the normal hair fall that happens, and it would not be a hair loss that is there. Also, the proteins that he spoke about, because we have to remember that our hair strands are almost 80 to 90% made up of proteins, and in addition we need the vitamins, minerals, the micronutrients which are very important, which he just spoke about, be it zinc, be it iron, be it selenium, and vegetarians may need to take supplements as and when required. So if we keep all these factors in mind and also take care related to the chemical products that we use or the parlor treatments that we use, the judiciously is what the word that he has used, and it is very important. So, well, going ahead, Dr. Kiran, I think before we go ahead, there is a question by one of our viewers. What about applying hair oil and hair gels? I think you have answered about the hair gels already. It is one of the chemicals, and you have to use it judiciously, otherwise it can cause problems.
Yep.
You would like to say something about applying hair oil, Dr. Kiran?
See, hair oil is basically a natural conditioner, and it has been used for ages and ages by mothers, grandmothers, and everybody. But those were the days when current conditioners were not available. If you look at it scientifically, a good conditioner which you get in the market today is a better product than hair oil. Hair oil, what it does is it sort of weighs down the hair because it coats the whole hair shaft quite thickly. Secondly, it will attract a lot of grime also. And if you use hair oil, is nothing wrong with it, but I would suggest that also, of course, if your scalp is oily, the hair oil is in fact going to worsen things like dandruff and seborrheic dermatitis, and clog the pores of your hair shaft from where the glands come out. So yes, again, I would say moderation is fine. If you oil your hair, do it at night, and you want to have a nice massage or something, feel good, well, that's fine. But if you even if you let it be overnight, it's fine. But I would suggest you wash it off in the morning, shampoo it off. If you a retail product conditioner is definitely a better option. These are scientifically studied conditioners, and they are better for healthy hair than natural oil.
Okay. So, well, what we understood is that oiling, probably it would help, the massage could help to relieve stress. You could feel good about it. It's a feel good factor too. And it would, one should wash the hair next day morning so that we don't attract the dust and the grime to it and worsen the problems. One of our viewers is asking, can female pattern baldness be reversed?
It can be helped by some medication in some. The medication does not seem to help everybody all the time. but it is worth definitely using medication. It can help, but it is not a reversible problem. It is unfortunately a condition, it's progressive. We can arrest it using the medication, but there are other things that we usually need to do if the person is concerned significantly about this problem. I would say probably about maybe about 20 to 30% of female hair loss, pattern hair loss patients do get some amount of help because of medication. But medication in the sense, these are not tablets I'm talking about. These are about
Applications.
application, something which is to be put on the scalp. And the
Right.
other thing is it takes a long time. I mean, we have seen patients need to use it for a year at least for it to show the benefit that it can have. But again, nothing to shout about. Not really very helpful in practical terms, because years and years of applying the same thing and getting some benefit out of it. So female pattern baldness, many a times, unfortunately, we need more a different kind of management protocols.
True. Well, going ahead, Dr. Kiran, I have found many people, they avoid washing their hair for days on end, maybe a week, 10 days also, and they actually avoid combing or brushing their hair out of fear of the hair fall. So, what would you advise them?
No, this is very irrational and does not make actually sense. Because remember one thing, the scalp is nothing but just another part of the body, skin that you have elsewhere. The thicker skin that you see on the head is your scalp. So just as you would take care of the rest of your skin by having a bath or washing your face, whatever. So the same thing needs to be done for the scalp also. You cannot let a buildup of dead cells and dirt and a lot of other things come onto the scalp. It will just worsen your problems. So
Right.
yes, oily scalp, you must shampoo almost every day if possible. If your scalp is dry, then probably you don't need to shampoo every day, maybe alternate days. Secondly, whatever you see coming out when you have a bath or a shampoo when you comb, please remember that that is already hair which has become loose from the follicle. And if it was not for your combing or for your shampooing, it would have fallen off any which way in a couple of days more. That's bound to happen. So what, like you said, these approximately 100 strands of hair a day are going to go. And there's, nothing you can do about it, and nothing you need to really do about it, because that same follicle is going to get activated again. Give it a few months and it's back in action and producing its hair again. So yes, doesn't make sense to avoid shampooing, avoid combing. All those things should be done regularly.
Right. So, healthy scalp is healthy hair, is what it is, right?
Yes.
And hair usually grows at a rate of around half an inch a month to 6 inches a year. That is usually what the rate of hair growth is. So, is it a myth or a fact that which people believe that cutting your hair helps your hair to grow faster?
Again, very, very irrational. The hair strand that you cut or that you style or do something is dead tissue. It's just a dead rope of protein, and what you do to it does not affect the follicle. It's the follicle which is the live part, and that is the one, that is the part which is going to give rise to your hair strands. What probably happens is when you cut the hair, it has a sharp edge and it is thicker at the point where you have cut the hair. So it's an impression that a lot of people get, that after cutting hair, suddenly the hair looks thicker and sharper and as if it's growing, but it's doing nothing of that sort. Doesn't matter at all.
Right. Well, viewers, the shaft is actually the dead protein cells of our hair, whereas the real follicle, the live part, is the one which is in the scalp from where the hair growth actually happens. Dr. Kiran, many people, many females, especially after delivery, experience great hair fall, and it's sometimes alarming and scary too. Why does this happen?
So this is again what happens is there is a huge change in the hormonal status of the woman's body, just especially after she has delivered. And
Right.
this huge change affects a lot of organs, not only the hair, but it affects the hair follicle tremendously, because these follicles are extremely sensitive to all the changes that take place in our body. They are like a sensor for the body, because hair follicles, the cells in a follicle are the second fastest multiplying cells in the body, and hence any change, they get affected very very easily. So this whole shift in hormones that happens sort of shocks the hair follicle, just as
Right.
acute stress will shock the hair follicle. Plus I'm sure any new mother will tell you that it is a huge stress also, so that stress factor is also there. Thirdly, the estrogens which are dominating, the progesterones which are dominating when the lady is pregnant, actually makes some of them give it gives some women a nice lustrous growth of hair. So
True.
when these three things happen, and suddenly after the baby is born, things change, the hormones change, the stress factors come up, and the follicle goes into, it's like it just gets a shock and it loses the ability to continue producing that hair. So we call this phase as telogen. And when this
Right.
telogen comes up, the strand of hair that was already existing in the follicle comes loose, and that is how you suddenly see some hair fall happening. And the good news is that just give it a few months, 6 months, sometimes 8 months, and you are back to having the same hair that you had earlier.
Wow. That is great news for to be mothers or those who have just delivered. Just as the body goes through changes during pregnancy, so also it goes through after delivery. But as Dr. Kiran said, you need not worry as long as your basic lifestyle, the food that you eat, the nutrition that is needed as per the pregnancy and later as per the delivery, if all is maintained naturally, this hair will be back. So that is really good news which Dr. Kiran has given us about. So Dr. Kiran, if the hair breaks from the shaft or it falls from the root, what does it mean differently? Or
Uh,
how is it different? What is different about it?
when the hair, if you look at the hair which has been shed off, if you look at it, and at one end, if it has a little swelling there, then that's the hair bulb, and that means the hair has come off from the scalp, from its root. If it is a sharp cut end, that means it is a hair shaft which has broken away from the rest of the hair.
Right.
Broken shafts obviously mean that the shaft, the strand of hair is not being taken care of properly. So this will happen in, again, extreme conditions, lot of shampooing, wet hair, rubbing vigorously, combing very hard, too much of combing, very fine toothed comb,
Right.
entangled hair,
Cosmetic.
long hair, yeah, breaks off quite easily. So you probably not using using too much of shampoo, maybe too much of hair treatment, too much of ironing, flat
Right.
ironing, or too much of chemical straightening is one process which really strips the hair of a lot of its cover and makes the
Right.
hair brittle. So you need to use special conditioners after straightening. Coloring also
True.
same story. So that's what broken strands mean. Sometimes broken strands could also mean that, for various psychological reasons, you have been fiddling around too much with your hair and breaking off the strands. If they are coming off from the root, like I said, it's a stress situation where
Right.
suddenly a lot of hair is getting shed from the follicle itself. So that is usually seen in either a hormonal change, like we talked about pregnancy and childbirth, or it could be because of emotional trauma or something like that, which is causing the hair follicle to go into the telogen phase that I just mentioned.
Right. So
So I
since you
think that is
spoke,
the importance.
right, since you spoke about stress, even previously you spoke about stress, how actually does stress lead to hair loss?
Well, there's with stress comes a whole system of hormones which are raging inside the body. When
Right,
stress is there, a lot of negative hormones are working. Now nature has endowed us with this stress response system to adapt to a bad situation, but unfortunately in today's life it also works in different situations. And these negative hormones also, like I mentioned to you, the follicle is not used to these kind of negative hormones, and that
right,
causes the problem. Secondly, stress means there is what we call as vasoconstriction. That is the blood vessels, the thin, narrow blood vessels, which are just under the scalp skin. They narrow down even further, and that causes a decrease in the blood supply to the follicles. And that is the reason why they generally go into, a shedding phase.
correct. So in short, the constriction in the blood vessels that actually cuts the blood supply to the
Yes,
follicle is what is responsible for the
yes.
hair loss related to stress, right?
Yeah. Plus the
Yes.
hormones itself, some of the stress hormones actually work directly on the follicle and cause them to shut down.
Right. So, well, since we're talking so much about stress, we can always say that stress can be combated through mediums like yoga, meditation, or whatever you feel helps to relieve your stress, because stress produces in our body a steroid-like hormone called corticosteroid, and we know what damage it can do to our hair follicles, and it can do to our body too. But if we maintain a good lifestyle, exercise, then we have the good hormones also coming into play, be it the serotonin, and that will help to combat the stress and help us to be relieved of our hair loss too. Right? Yes,
Yeah,
Dr. Kiran?
absolutely. Absolutely.
Yes.
You put it all together very nicely.
So, Dr. Kiran, coming to the most important question for which you have had experience of almost 30 years, 3 decades. I would like to ask, which are the candidates best suited for hair transplant?
Practically everybody can, be a candidate for a hair transplant. But the important thing is to know what exactly is the result you can get and whether you are willing to undergo this procedure to get that kind of a result. So, you have 10 different patients with 10 different types of hair loss. And if they are all, some of them won't even be candidates for hair transplants. The commonest candidates for hair transplants are males. Males are good candidates. Males with genetic male pattern baldness, also called as androgenetic alopecia. So those are ideally the most, they form the largest group for whom hair transplant is a suitable option. Besides that, of course, they should be, it shouldn't be the hair loss should not be very severe. It's, if if the whole scalp is practically close to balding, then maybe that's not a great idea. Maybe they need other ways of managing. But if you have moderate balding, it's an excellent method. You should also have what we say good donor hair, in the sense the remaining hair on the side and the back of the scalp, they should
Right.
be as thick as possible. If they are in their thick hair, they are close together with good density, and these are the best candidates for a hair transplant.
Right. Okay. We have one last question which has come up from one of our viewers. Will hair fall during the pre-menopausal stage also reduce after a certain period of time?
um, well, you see, actually after menopause there is an increased amount of hair loss. again, it's because of the lack of estrogens and progesterones, the change which has happened in the body, that in fact causes a more what we call an androgenic body environment. And androgenic body environments means a male-like situation. It's not male-like, but basically you are losing your female hormones, or the levels have subsided, and that in fact worsens pattern hair loss or age-related hair loss. Scalps
Right.
become thinner in women after menopause. So it's not that they will reduce, they don't reduce after menopause, they'll actually increase after menopause.
Right, because the female hormones actually support the follicles and the growth,
They are
whereas
good,
after
yes.
menopause, as they go down, is what impacts the hair loss. Right.
Just like everything
So,
else in women, their hormones too are wonderful. So for hair as well.
right. That is why I think a male pattern baldness sets in quite early, which we have seen almost even teenagers and people in 20s having it, but females, because of their hormones which are present, usually can pull on and prevent the female pattern baldness almost till menopause. Is that right?
Yes, yes, very much. Unless there are some associated issues which need investigation, thyroid issues, diabetes,
Yes, true.
blood pressure, medications for these things. So
Right.
unless that is there, I think what you said is perfectly right.
Correct. Right. Yeah. I was only asking about the hormone related, the female hormone related part, about the pre and the post menopause thing.
Correct. Yes.
Okay. Yes. So thank you, Dr. Kiran. It was really nice. Your tips, insights, and knowledge, I'm sure, will help our viewers to prevent hair loss, to reverse it as and when it is possible. For those who cannot reverse the hair loss or are suffering from more or less permanent type of hair loss, or the pattern hair loss, whether the male pattern or the female pattern as it be, I would like to first say that चाहे आप अपने बाल खो बैठे हो, पर इसके पीछे आप अपनी नींद और सुकून न खो बैठना. For we have two options. Dr. Kiran has given us the first option already. He has told us about hair transplant and which are the good candidates who can be for hair transplant, which he just mentioned a few minutes ago. And otherwise, second, I would like to say, चाहे सर पर बाल ना हो, दिल में उमंग और जोश हमेशा बनाए रखना. Viewers, as much as you may think that confidence comes from beauty and looks, or beauty and hair, as it is for this session, it is our crowning glory. But I would like to say, confidence begins the moment you decide to be yourself. And with this, I would like to once again thank Dr. Kiran, thank our viewers for being here today with us. Do share this video and spread the knowledge, the insights that Dr. Kiran has given us in this session today. And don't forget to like, follow, and subscribe to our social media handles, be it Facebook, YouTube, or Instagram. And you can connect with Dr. Kiran on the Instagram handle, The Beauty Doctors. Thank you so much, everyone. Have a great evening and a great weekend. See you next week, same day, same time. Bye-bye. Thank you, Dr. Kiran.
Thank you so much. It was so good being here, and thank you for doing a wonderful job that you're doing of giving so much wonderful information to all your viewers. Thanks a lot.
Thank you so much. It's our pleasure. Bye-bye. See you
Bye.
soon.
Bye.
Bye.